Hello, my name is Taylor McClanahan. As an assignment in Epidemiology 1, I will be critiquing the article titled Seroprevalence of SARS-CoV-2 Specific Antibodies Among Adults in Los Angeles County, California. The study took place on April 10th and 11th of 2020. The purpose of this study was to conduct serologic tests to obtain a better estimate of the incidence of severe acute respiratory syndrome coronavirus 2 infection. The serologic tests have the ability to detect both active and past infections. The recent COVID-19 epidemic has led researchers to strive to increase the available knowledge and data about the disease. The number of confirmed cases have been based off of patients that are symptomatic. This excludes those that have recovered, those with mild or no symptoms, and those that have symptoms but due to a limited amount of tests could not be tested. The objective of this study was to conduct serologic tests to obtain a better estimate of the incidence of severe acute respiratory syndrome coronavirus 2 infection. The study reached out to residents of the Los Angeles County in California to test for this coronavirus 2 specific antibodies. Residents within a 15-mile radius of the testing site were eligible to participate in the study. On April 10th and 11th, there were 6 testing sites available for testing for the antibodies. It was important for the study sample to include a distribution of different ages, sex, race, ethnicities, and income values. For statistical analysis, data version 16 was utilized with a 95% confidence interval. At the end of the testing, there were 863 individuals that participated in the study. Majority of the participants were white women between the ages of 35 and 54 years old. A total of 35 individuals tested positive for the SARS-CoV-2 specific antibodies, IgM or IgG. The weighted prevalence was determined to be 4.65%. Using the calculated prevalence of 4.65%, it was estimated that approximately 367,000 adults in this county had the antibodies on April 10th. The amount of confirmed cases may actually result in a higher fatality rate than compared to the number of infections. A market firm called LRW Group provided the information of the residents in Los Angeles County. The study only collected data from this one county. 1,952 residents were invited to participate in the study. 1,702 individuals consented and agreed to participate. 865 residents were actually tested for the antibodies, but 2 kits were faulty, so this resulted in 863 participants in total. Selection bias may have been involved because some patients may have agreed to participate because they may have experienced symptoms. Bias for analysis was reduced by using binomial and bootstrap methods. To obtain statistical data, Stata version 16 was analyzed. The study evaluated the number of positive tests using a 95% confidence interval. As previously mentioned, 35 participants in the study tested positive for the antibodies. The prevalence of 4.65% was used to estimate approximately 367,000 residents from this county may have the antibodies. The study explained that the fatality rates based on positive antibodies may be higher than if it was based on those with confirmed infections. Some limitations of the study include that it was only restricted to one county. It would have a stronger representation if more residents from different counties were tested for comparison. Also, the estimates of sensitivity and specificity of the testing kits may change. It could be discovered that it is less or more accurate than before, which would definitely alter the results. This is the reference of the article used for this critique. Thank you so much for listening.